Hey LOGCOM, this is Jen Napier coming to you from my home. With all the information out there about COVID-19, it's easy to get overwhelmed. So command leadership wants to emphasize the importance of keeping in touch with your supervisor, self-reporting, and also let you know the measures they are taking when an employee tests positive for COVID-19.
In order to protect the health and safety of our community, it is important that we all have open and honest communication with our supervisors. Self-reporting ensures measures can be taken to protect the workforce and assist leadership in ensuring you get the support you need. You should self-report the following: if you are sick, even when it may not be related to COVID-19, if you have been exposed to someone that has been diagnosed or presumed to have COVID-19,
And you should inform your supervisor if you plan to be tested for COVID-19, when you have been tested and are awaiting results, and when you receive your results. If you test positive for COVID-19, your supervisor will provide you additional guidance.
if you experience fever, fatigue, cough, sneezing, sore throat, headaches, aches and pains, shortness of breath, or respiratory trouble, you should seek medical attention and evaluation from your primary care provider or by calling one of the numbers listed here. If the medical evaluation determines it is warranted, you should be tested for COVID-19 and remain at home while you await the results. If an employee tests positive for COVID-19, the command will be taking the following actions.
They will evacuate any immediate work area that the infected employee occupied within a week of testing positive and secure all entry points until the command is able to coordinate proper disinfection of the workspaces.
The command will request that the infected employee identify all individuals they may have come into contact with either in or out of their work section within the past 2 weeks of testing positive. The command will then alert all employees who are identified, worked closely with, and may have come into contact with the infected employee. The individuals identified will be asked to isolate in their homes for a minimum quarantine period of 14 days to ensure the infection does not spread. Supervisors will remain in communication with the infected individual and monitor symptoms as they develop, and also keep the chain of command updated regarding the health of the infected employee and any other employees who might further develop symptoms as a result of contact.
Marine Corps Logistics Command is committed to protecting your privacy and will only share medical information with those who need to know. As we learn more about COVID-19, guidelines on testing and mandatory waiting periods may change. If you tested positive for the virus, you should seek guidance from your supervisor on the most current return to work protocol and not return to work until you receive their approval. We want to thank all of you for embracing the measures that have been put in place to keep our workforce and families safe and continuing to work hard to complete the command's mission to provide world-class logistics support to our Marines. Thank you so much for listening. Keep social distancing, washing those hands, and staying flexible, and we'll get through this together.